Hi everyone, my name is June Romero and this is the Transcript. I decided to start the Transcript as a personal platform for blogging opinion pieces, interviews, and content from the mind of a Miami trans woman. I am a 26-year-old American transgender Latina living in Miami, and personally I feel like that's a point of view and a perspective I don't see enough of, and I'd like to add my voice to the chorus of voices on the internet, and I hope you enjoy the content that I bring. This first interview, which I've decided to launch the Transcript with, is actually an interview that came about because I was so conflicted personally about a video that resurfaced about a week and a half ago featuring a doctor by the name of Dr. Stella Immanuel and a group of doctors behind her. I think you've all seen the video, and I was personally perplexed by the facts and the claims being made in the video, and I wanted answers. So I decided to conduct an interview with Dr. Amy Wecker, who is an infectious disease specialist in Miami, and I hope that our interview can shed some light on COVID-19 and any questions you may have had surrounding it. I look forward to hearing from you all and taking any suggestions for what videos or content I should make next.
Yes.
All right, Dr. Wecker, thank you so much for joining me again. My name is June Romero, and welcome to the Transcript. I am here today with Dr. Amy Wecker, and I will let her introduce herself.
Hi, thanks so much for having me. I'm Dr. Amy Wecker. I'm a board-certified internist and infectious diseases specialist, and also anti-aging, functional, and regenerative medicine, although I'm not sure that that's relevant to our conversation today.
Always relevant. We're always plugging you, Dr. Wecker. So anybody out there listening who has some interest in anti-aging medicine and anti-aging practices, you can see Dr. Wecker. She looks phenomenal. She is phenomenal. She's a wonderful doctor. She's my doctor, and I'm incredibly proud of that. I've contacted Dr. Wecker today, and I've organized this meeting because she is an infectious disease specialist, amongst other things. And I have to say, Dr. Wecker, I was prompted to do this video, of course, as a series of videos that I'm doing for a new blog called The Transcript, but also because I was just pushed to this by the video that surfaced almost 2 weeks ago, about a week and a half ago, of a doctor by the name of Dr. Stella Immanuel, who stood in a white coat, accompanied by a number of other doctors in white coats, on the steps of the Supreme Court, and touted hydroxychloroquine amongst other things, and sort of like, you know, negated the use of masks, whatever. But I was taken aback by that video. I was sort of intellectually shook, because I consider myself a person who makes good and sound decisions, who informs themselves, and I gotta tell you, I was really questioning everything after that video myself. So have you seen this video, Dr. Wecker?
Yes, I have seen the video, and let me first tell you that I think The Transcript is such a clever name, so kudos to you for that. Yes, I did see the video, of course. I think everybody saw the video, and frankly, I was horrified and kind of embarrassed, you know, as part of the infectious diseases community, because it was just a lot of misinformation, and there's so much fake news circulating these days. And people have a hard time sifting through it, because yes, you watched it and she did seem very believable, but of course it's total nonsense. But it's hard to separate fact from fiction if you don't have medical training. Yeah,
and that's why I've contacted you, because on my feed, on my Facebook feed, Dr. Wecker, I saw friends of mine from high school, contemporary friends of mine, some of them dentists, some of them nurses, some of them medical assistants. I mean, I was taken aback by how many people were pushing this video in support of her message. And I'm going to lay the sort of the facts and the claims she made. So Dr. Stella Immanuel stood in front of the steps of the Supreme Court, and behind her a chorus of doctors in white lab coats. And she said that she has seen 350 patients and treated them by prescribing them hydroxychloroquine, and that none of those 350 patients at her practice ended up developing serious or severe symptoms or having to be hospitalized of COVID-19. And I ask you, is that possible? While simultaneously it's still being possible that this is an incredibly dangerous virus and disease.
Yes, well, there's a few things here. So first of all, hydroxychloroquine is a very useful drug for malaria, but there were a few different studies that were done looking at it for treatment for COVID, and it just does not work. And the trials actually were stopped early because hydroxychloroquine can cause very dangerous, sometimes fatal cardiac arrhythmias. And this is not new. We've known this for a long time. But of course, when you're dying of malaria, the benefits outweigh the risks. But when it doesn't actually treat COVID, then the risks outweigh the benefits because it doesn't work. So there's the one thing. So it's not just a benign therapy, like if you take an aspirin, not that that's totally benign, but probably nothing will happen to you. But this really can be quite dangerous. So then the next thing is that COVID is real and can be, of course, fatal, as we've seen from many deaths all over the world. But it also can be pretty benign, and it really depends on who you are. So younger people do better, healthier people do better, thinner people do better. I mean, there's a variety of things. So as far as I'm aware, Dr. Immanuel is a pediatrician, so I don't know who these patients are that she saw, but if they were children, they probably did do pretty well, because not that children can't get sick, but they tend to do quite a bit better than adults with COVID.
Yeah, and my understanding of it, of her experience is she is a pediatric doctor. She has a family practice in the Houston area, or had recently. And so that's her sort of background. She provided no evidentiary support. She provided no research, no documentation, no case studies, and no paper trail. So that's something I feel like people should really take into consideration when hearing her claims and when giving her any weight. Um, and also, I'd like to point out, and I'm sure there are, thousands, tens, dozens of thousands of doctors, perhaps hundreds in this country. There are, we're a country of 330 million people. Inevitably, there will be those that dissent, in opinion. Inevitably, there will be those that challenge the status quo. But what I see here is really dangerous, because what I saw when I saw that video, to be honest with you, after I sorted through the smoke and mirrors, was essentially a propaganda arm. There are folks, mostly in the conservative sort of wing of the country and the government, that have vested interest, obviously, in the economy humming back to life and everything opening up. And these folks, if you actually do a little research, there is a group, a for-profit group, a lobbying group, essentially, that funded for these doctors to take this trip, to spread this message. All those lab coats that were perfectly embroidered all the same, those are not free items, right? So we have to assess these things for what they are, using the factual evidence before us. And I have to ask you too, so the mortality rate seems to be hovering at between 1% and 2%, less in some areas, more in some areas. Of course, there are spikes, and like you mentioned, a person's overall sort of like health picture, of course, bears weight on the symptoms, or the severity of symptoms. But I ask you, is the mortality rate the only determining factor of concern here? Should it be the only thing we're worried about, or are there other things about COVID-19 that could potentially spiral out of control?
Well, there are other things. I mean, it's a very complex issue. So first of all, of course, you do have the mortality rate. Then you also have long-term complications of COVID. So some people do end up with long-term pulmonary complications, long-term neurologic complications. There can be coagulation disorders. People get blood clots. So there's those type of things. And then there's also, I think, a huge fallout in what I'll call para-COVID related mortality. So there's a lot of fallout with the social situations. There's a lot of unemployment, a lot of poverty. There's a spike in drug use. There's a spike in mental illness. We were already in the midst of an opiate epidemic, which nobody has been talking about so much lately, but that's been killing over 60,000 people a year for the last few years. And that definitely has spiked. People are depressed, they're feeling isolated. So you have to take all those things into consideration.
Yes. Wow. Thank you for bringing that up too, because, there seems to be, in the United States, in the world at large, we're experiencing this phenomena again of the division into essentially two different parties of people, right? So you've got the liberal agenda, as people call it, the conservative agenda, and there is this war being waged ideologically in the world right now between those two. And because of that, it has bled into the medical sphere. It's bled into this issue, the pandemic. The distrust of entities in power, the distrust of authority, of media, of politicians has now bled into the distrust and become the distrust of medical experts. And there is a camp that will say, what about all the other things that this is causing? You know, should we shut down? Should we not shut down? And I'm hearing you, and my understanding is really this is the reason that we need to be incredibly precautious and preemptive. A developed nation with so many resources as we have, to really take preemptive measures once even the slightest sign of danger appears, even across the Atlantic. So, you know, would you agree with that?
Oh, absolutely. Oh, that we should have been more proactive at the beginning? Oh, absolutely. I mean, it's kind of mind-boggling to me how much we tried to ignore this until it had completely spiraled out of control all over the country.
And now, my understanding is at last estimate, it's about 10-15% of the population that's been infected with this. And so this is something that we're still not even partially out of the woods of. Would you say that we, because of our response or lack of a response nationally, would you say that we are now going to face this for a much longer time than we would have had we taken steps to stop it?
Well, I mean, that's a kind of a complicated question. So, I mean, I guess, yes. I mean, we definitely let things spiral out of control. And at this point, so many people have been infected that there's really no role anymore for contact tracing. Or, I mean, there's just so many cases where beyond that. But on the other hand, interestingly, I mean, if you look at a country like New Zealand, let's say, that just closed down their borders, so they're doing okay, right? They're living their lives, they're out and about, they're going clubbing, and, you know, they're doing their thing. But the problem is that they're not developing immunity. And so, I mean, yes, I mean, at some point we'll have a vaccine, but right now they have to keep their borders closed because they can't let anyone in. So that's problematic. Then you look at another country like Sweden that just did some distancing, and everybody was really down on Sweden at the beginning, but, you know, they're generally at the forefront of all things medical. And it looks like now that Sweden's cases are really dropping. They didn't have too much of a hit to their economy. And it looks like maybe Sweden was the country that did things the right way. But certainly, yeah, certainly we bungled it here. We could have been smarter about the distancing at the beginning.
Yeah, and the contact tracing too is incredibly effective if done at the right time, right?
At the right time, yeah. You can only contact trace so many people. I mean, once you have, you know, hundreds and hundreds of thousands of cases, it's just not feasible.
Thank you. So, Dr. Wecker, what would you say to folks who are developing this kind of distrust in the information being disseminated by medical experts, medical professionals, you know, entities and institutions that have long been just established for the purpose of public health and service? What would you say to those folks who are sowing distrust?
Well, I like to think that as a general whole, the medical establishment is pretty trustworthy. I mean, I think that video, like I said, was really an embarrassment to the medical community. And I think by and large, physicians are trustworthy and the medical system is trustworthy. And if you do start to feel sick, you need to go to your doctor. If you're very sick, you need to go to the hospital. That's another thing, actually, that I didn't mention earlier with the whole para-COVID thing, that a lot of people who normally would go to the hospital, like, let's say if you wake up with crushing chest pain, normally you don't think about it. Okay, I could be having a heart attack. I'm going to the hospital. There's no question. Now people are actually staying home with their heart attacks, with their appendicitis, with their aneurysms. They're dying because these are emergencies that need to be handled in the emergency room, and they're not going to the hospital because of this distrust. So I think that if you don't feel well, you have to go to the doctor.
Yeah, thank you. Dr. Wecker, what has your personal experience dealing with COVID patients been? Have you had any?
Yes, so I am an infectious diseases specialist, but a couple of years ago, I stopped going to the hospital because I run a clinic full time. So my patients skew to be a little bit younger and healthier than the general population. So for my patients that have had COVID, I have just been treating them with short courses of oral steroids, and they've actually done very well. And I'm not saying that steroids are a cure for COVID, because there is no cure for COVID, but certainly steroids are very anti-inflammatory, and severe COVID, it's an inflammatory condition. So I've been treating my patients with steroids, and when I feel that there may be a bacterial infection present as well, I give them some antibiotics, and I'm very fortunate. My patients have really done pretty well. I haven't had anybody die, or even have had maybe a couple of people be very briefly hospitalized, but for the most part, everybody's done well. But my one of my partners, who runs a clinic in North Miami, sicker population that tend to skew towards a lower socioeconomic status. And she actually has had, I believe, about 6 patients die. And a couple of them actually died from COVID. And the other ones, it was this whole para-COVID thing. They just dropped dead at home. Presumably, they had some symptoms of something like a heart attack or something that would have normally driven them to the hospital, but they were afraid and they stayed home. So it really depends a lot on your underlying health.
Right. And some areas, as naturally, because again, you have folks saying, contesting the realities, and they're saying, I drive by the hospital, it's not packed. I drive by the clinics, they're not overflowing. I drive by the funeral homes, they're fine. So what is all of this nonsense, and what is all this hoopla, fake news? But of course, everything is circumstantial, right? So, there are areas that are hot spots. There are areas where there are spikes. There are areas where social, economic, demographics affect, of course, the outcome of COVID. So
yes.
It's really...
Oh, and there's one other thing actually that I wanted to mention that I didn't mention, that people aren't talking about too much, but it's really important, and that is the whole concept of inoculum. So it makes a big difference how much virus you get exposed to, right? Getting exposed to 10 viral particles versus 10 million viral particles is very, very, very different. And so if you have some type of very casual contact with someone who has COVID, and, let's say you're wearing a mask, which masks do protect you. They're not 100%, but they definitely will reduce the inoculum. So if you get exposed to, a handful of viral particles, maybe you get a little bit sick, or maybe you don't get sick at all. It's very, very different than if you are in let's say a crowded bar with a lot of people that have COVID, and you get exposed to a really high number of viral particles. You could actually be a completely young, healthy person with no medical problems at all, and end up getting sick if you get exposed to enough virus. And that's just honestly a matter of people's own stupidity to put themselves in those kind of situations.
Absolutely. So there is a pragmatic approach to this, is what you're saying. Viral load is a factor, right? And we can decrease our intake, or our potential of intake, of a large viral load if we wear masks, if we distance ourselves. So this is not a end all be all. It's not a stop all, right? But we have to make decisions in our own lives that are intelligent, and really keep us away from large crowds, close quarters, close proximity, and closed spaces where airflow is restricted or recycled, right?
Yes. And I'm not suggesting, again, you have to assess your own risks. So if you're elderly or very immunocompromised, you need to be super, super, super careful. Like, let's say someone like myself, I'm a healthy 45-year-old. I'm living my life, okay? I'm not living in a bubble. I'm getting on airplanes. I'm going grocery shopping. I'm doing my thing. I go out to eat outdoors. I put a mask on. When I'm on the airplane, I'm wearing a mask. So most of us, we don't need to live our lives in a bubble, but nor do we need to be at some pool party without a mask on. You can't be stupid.
Thank you, Dr. Wecker. So yeah, I appreciate that, because there are folks out there, it's either one extreme or the other. I'm terrified, I stay in, or I go out and I do whatever I want. And there's a middle ground here that we all have to walk in order to keep each other as safe as possible. And we're learning now how important community is, right? For those of us who are so individually minded or individualistic, we're learning now that that's not even a reality of being human. We, our actions and have repercussions for other people, right? So there's a ripple effect about being a person during this pandemic.
Absolutely.
Well, Dr. Wecker, thank you so much. That was so informative, and I know that people will get a lot out of it. I appreciate you taking your time out. Thank you so much for coming on the Transcript.
Thank you so much for having me.
Of course. You have a nice day, Dr. Wecker.
You too.
Thank you all so much for watching. If you enjoyed our conversation and would like to see more from the transcript, please subscribe to our channel and follow us on social media. I will provide all of the handles in the video description below. Thank you so much, and I look forward to seeing more of you.